Okay, welcome to the deep dive. Today we're getting into vitamin D testing. It's really quite important, especially if you live somewhere, that doesn't get endless sunshine, like here in the UK, maybe Cleethorpes, for instance. This info is definitely for you.
That's right. We're using a guide from Blood Test UK called Vitamin D Blood Test in Cleethorpes, your local guide. And our mission really is just to quickly get our heads around why this vitamin matters so much and crucially, how people right there in Cleethorpes can check their levels pretty easily, actually.
Okay, let's keep it simple. Think of vitamin D like a little helper for your body's building blocks. It does two really big things. Helps keep your bones strong and helps your immune system, fight off colds and stuff. And since the sun is the main way we get it, and we don't always see much sun here, especially in winter.
Right.
It means low levels are, they're pretty common. And that's exactly why getting tested is a good idea.
Yeah, and that guide from Blood Test UK really highlights its core job. Vitamin D is key because it lets your body actually use calcium. Calcium's like the bricks for strong bones and teeth.
Oh, okay.
But without enough vitamin D, your body just can't absorb that calcium properly. And that's often why people feel that nagging bone pain or just really, really tired. Fatigue.
A tiredness link is interesting. I bet loads of people just think, I'm stressed or not sleeping well. So if someone feels down a lot or just constantly knackered, maybe they should think about this test.
Definitely.
Who else should be thinking about checking maybe like once a year?
Well, Blood Test UK points out a few groups. People who work indoors most of the time. People with naturally darker skin tones because melanin blocks some UV.
Okay.
Pregnant women too, and older people, as their skin doesn't make vitamin D quite as well.
Right.
And thinking bigger picture, testing regularly, maybe annually for many, it's about preventing problems down the line. It could even save money.
Hold on, save money? How does getting a test save money? Sounds like another cost.
Well, think about it. If low vitamin D goes unchecked for ages, it can lead to bigger issues. Things like really weak bones, osteoporosis.
Right. Those are expensive problems.
Exactly. Treating those costs a lot more later than just doing a check now. So Blood Test UK emphasizes that being proactive is actually cheaper in the long run. Plus, sometimes sorting out low D levels clears up that vague tiredness, maybe saving trips to the doctor for things that aren't easily diagnosed.
That makes a lot of sense.
Yeah.
Okay, let's talk numbers then. People get results back. What should they be looking for? Are there key numbers?
Yes, good question. It can be a bit confusing. Blood Test UK gives some clear ranges. The sweet spot, the optimal level, is between 50 and 125 nanomoles per liter. That's nmol.
50 to 125. Got it. That's the goal.
That's your target, yeah.
Now, what if it's low? Like really low?
But importantly, there's a middle zone between 30 and 50 sunoral. That's called insufficient.
Insufficient. So not terrible, but not good either.
Exactly. You're not severely deficient, but your levels are still too low for optimal bone health and immune function. Lots of people in the UK fall here. And those people still need to do something, maybe more sun safely, certain foods like oily fish or possibly supplements. Needs attention.
That insufficient level is really key then. Means you should act even if you don't feel drastically ill. Right, let's get local. Cleethorpes. How easy is it actually to get this test done there? The guide suggests it's not too hard.
No, it seems quite straightforward. Blood Test UK lays out 4 main options for people in Cleethorpes. First, there's your local GP. That might be free on the NHS. The potential downside is it can sometimes be a bit slow, depends on their criteria and how busy they are.
Okay, the standard route. What if you want it quicker?
Then you've got private choices. Private clinics offer tests, usually faster results, but there's a cost maybe £30 to £100, something like that.
Right.
Some local pharmacies offer testing too, often walk-in, which is handy.
Pharmacies, okay.
Convenient. And the fourth way is at-home kits. Usually a finger prick test you do yourself and then post off to a lab. Super convenient.
Those home kits sound easy, but are they accurate enough? Especially with these specific numbers like 30 or 50.
That's a fair point. Quality can vary a bit. Blood Test UK's guide likely recommends reputable providers. The key is choosing a good one. Generally, though, if your level is properly low, say under 30, pretty much any test, including a decent home kit, should flag that up clearly.
Okay.
It tells you there's an issue and you need to talk to a professional. So, just knowing is often worth it.
So, wrapping this up for someone listening, checking your vitamin D, it's actually a pretty simple step you can take. Good for your bones, maybe helps your mood, boosts your overall health, Especially important here with our sometimes limited sunshine. It's proactive.
Absolutely. And a final thought. You know how symptoms like tiredness or feeling a bit low can be really vague? We blame stress, lack of sleep.
Yeah, all the time.
So, how might making a vitamin D check, say, an annual thing, maybe every winter, how might that change how you think about your general health? Just remember, whatever your results, always talk them through with a healthcare professional to figure out the right next steps for you. And you can find more local details on the Blood Test UK website.